Okay, welcome to Drug Names Decoded, Chapter 2. I'm going to be talking about the musculoskeletal system and the drugs that go along with that. They begin with the analgesics, the NSAIDs. That's how that's pronounced. Because we have two consonants to begin the word, the N and the S, we sound out the N and then SAIDs. So NSAIDs, and usually it's all caps, NSAID, and then a small s at the end. Analgesics that are not narcotic, opioid analgesics, drugs for headache and migraine. This is another acronym, the DMARDs, the disease-modifying anti-rheumatic drugs, anti-inflammatories, and steroids. Some of the NSAIDs have anti-inflammatory activity, but in this case we're going to talk about the anti-inflammatory steroid, drugs for gout, and then drugs for osteoporosis. So NSAID analgesics, non-narcotic analgesics, opioid analgesics, headache and migraine drugs, DMARDs, which are disease-modifying anti-rheumatic drugs, the anti-inflammatory steroid, gout, and osteoporosis agents. The first drug is Naproxen, and I did italicize the EN at the end, but sometimes the suffixes are so short that it doesn't really help us. There are too many other drugs that are going to have this same suffix. But you will see that ibuprofen and naproxen both have ENs at the end, and aspirin, although it doesn't have an EN at the end, it has an IN, and acetaminophen has an EN at the end. But those aren't really enough to help us in terms of saying, oh, I look at this suffix, I can say that's a non-steroidal. But naproxen is a non-steroidal anti-inflammatory. Its brand name is Aleve over-the-counter, or Naproxen by prescription, Naprosyn, and then Aleve, and that is naproxen. The next drug is aspirin. I think this one is very familiar. It's gotten a lot more useful, or it's become a lot more useful since they've discovered that it helps keep platelets from sticking together, helping with heart disease patients. Aspirin is ASA, which is acetyl salicylic acid. That's acetyl salicylic acid. But you'll see that acronym ASA for aspirin. And brand names really vary. You might have something like Ecotrin, which is enteric-coated aspirin, ECOTRIN, as a brand name. Otherwise, there are many, many brand names for aspirin. But aspirin is the next drug. Ibuprofen is also a non-steroidal anti-inflammatory. This one doesn't last quite as long as naproxen. And a brand name for ibuprofen might be Motrin, Motrin, Advil, Advil. So Motrin or Advil, and that's ibuprofen. This one also is probably familiar to you, maybe more familiar with the brand name, but this is Acetaminophen. And Acetaminophen is a different kind of drug because it is a non-opioid analgesic, but it is not a non-steroidal. And so it kind of falls into a middle-of-the-road category. And what's special about acetaminophen is it doesn't really tend to cause that GI upset that the non-steroidals are famous for. But this is acetaminophen, better known as Tylenol. But in terms of brand names, acetaminophen has many, many brand names. If you were to look on Wiki or something like that, you would probably see 30 or 40 of them. But acetaminophen, a non-narcotic analgesic. Codeine is our first narcotic analgesic. An analgesic is simply something that is for pain. This is different than an anesthetic, which we'll talk about at another time. But codeine is our first analgesic. And I didn't really put a brand name for this. You're going to see this in combination products. You can see it alone, but I just left it at codeine. The next drug is fentanyl. Okay, it's fentanyl, Fentanyl. And this is an narcotic analgesic. And you might see the brand name as Duragesic. And this is fentanyl. And what we really want to be careful with this drug is that it's 100 times more potent than morphine. So you're going to often see, instead of milligrams or something like that, you'll see fentanyl in micrograms. The next drug is a combination drug. It's oxycodone with acetaminophen. That's oxycodone with acetaminophen. But instead of acetaminophen, you see this APAP. And the APAP stands for the chemical name of Tylenol or acetaminophen. So again, this is oxycodone, and we see this codone, C-O-D-O-N-E, which is very similar to codeine, and that's because these drugs are related. Oxycodone is a very strong or narcotic analgesic and related to codeine. So a brand name for this drug would be something like Percocet or Endocet or Roxacet, depending on who the manufacturer is. In the book, I just put that Endocet is Endo Pharmaceuticals' version of Percocet. Okay? And also note that that set comes from acetaminophen or acetaminophen, and that's where the name comes from. The next drug is morphine, named after the god of dreams, Morpheus. And I didn't put a brand name for this one because there are really too many of them. But morphine is another narcotic analgesic. Tramadol. This is an analgesic, and it doesn't really have a tremendous amount of opioid activity, so it's not scheduled. It's not DEA scheduled, but it's Ultram, U-L-T-R-A-M, which is Tramadol. And although it is an opioid analgesic, it's a weak opioid, and it's not supposed to be addicting. And not to get into the issues with addiction too much, but sometimes the addiction is not necessarily to the drug itself, but that if you have pain and your pain is relieved, and someone takes away that thing which was relieving your pain, well, that's going to make you uncomfortable and you're going to want that. So it's not necessarily an addiction to the drug, it's just it was helping you and now you've lost it. But that was Tramadol, which is Ultram. The next one is Hydrocodone with acetaminophen, and again we see this APAP, and we also see that suffix codone. That codone is very similar to codeine, so oxycodone, hydrocodone, and codeine, all very similar drugs. Hydrocodone with acetaminophen is the #1 drug in the country in terms of use as a generic, not in terms of dollars drug sale. And it has two brand names that are most familiar, which are Vicodin, which I had in the book, and Lortab. So Vicodin is V-I-C-O-D-I-N, and then Lortab is L-O-R-T-A-B. But that's hydrocodone with acetaminophen. The next drug takes us into a new class, and that's Almotriptan. Almotriptan has that suffix T-R-I-P-T-A-N, or triptan, and it's a migraine drug. So Almotriptan is Axert, A-X-E-R-T, and that's Almotriptan, which is a migraine drug. The next drug is very similar. We can see the suffix triptan. Sumatriptan was the very first of this class of drugs, and Sumatriptan's brand name is Imitrex, I-M-I-T-R-E-X, and that's Sumatriptan. The next drug is available over the counter, and you're probably not going to not remember, but recognize this drug from these acronyms. But ASA is aspirin, or acetyl salicylic acid. APAP is Tylenol, okay, or acetaminophen. And caffeine is caffeine. So what do these have to do with headache? Well, Headache is an inflammatory issue, so the aspirin helps with that part of it. The acetaminophen helps by being an additional analgesic. And the caffeine helps because caffeine is a potent vasoconstrictor. And if you can constrict or narrow the blood vessels in the brain that might be swollen, that would take some of the pain away as well. So aspirin, Tylenol or acetaminophen, and caffeine all combine to make Excedrin. That's Excedrin, Excedrin, and that's aspirin, acetaminophen, and caffeine. Our next drug is a different class of drugs, is prednisone. And prednisone is an anti-inflammatory steroid. Its brand name is Deltasone, Deltasone. And often when we see the sone endings, we're going to know we're dealing with some kind of steroid. So this is prednisone, which is Deltasone. Etanercept is what's called a DMARD, or a disease-modifying anti-rheumatic drug. And these drugs are extremely expensive and are used for very severe arthritic conditions. But again, Etanercept is Enbrel, Enbrel. That's Etanercept. The next drug is also a DMARD. It's Methotrexate, and the brand name for this is Rheumatrex, Rheumatrex, and that rheuma stands for rheumatoid arthritis. But Methotrexate is Rheumatrex, also a DMARD. Ibandronate takes us to another class of drugs, and Ibandronate is an osteoporosis agent, and we're going to see that this Dronate is consistent with these agents. They're bisphosphonates. But more importantly, when you see this Dronate, you know it's a drug that's going to help with osteoporosis. So Ibandronate is Boniva, Boniva. That's Ibandronate. Alendronate was the first drug in this class. You used to have to take it once a day. Then it went to once a week, and then it went to once a month. But Alendronate is a drug, Fosamax, Fosamax, which is Alendronate. Colchicine is a drug for gout. This is Colcrys, Cholcrys, which is colchicine. And colchicine is used when a severe gouty attack comes on. That's when we use that drug. Allopurinol is a drug meant to reduce uric acid so that gout attacks don't happen. This is Allopurinol, and the brand name is Zyloprim, Zyloprim. Febuxostat, this is Uloric, Uloric, and this is Febuxostat, and this in principle is going to do the same thing as allopurinol, which is to lower uric acid, preventing gout attacks in the first place.